Hey everybody. Gonna pull it back. Had to adjust. So we're waiting for I just sent an invite to Dr. Taylor.
Okay.
Hi everybody. We're waiting for Dr. Taylor to get on. I have Dr. Davis
Hello,
here.
everyone.
So please get your questions and your questions ready in the chat. Make sure she gets it. Okay, and then let me got her invite. Can you hear me, Dr. Davis?
I can hear you. Can you hear
Okay,
me?
just make sure. Because I saw your mouth moving, but then I couldn't see
Oh,
you.
yeah. No, I was just saying that you got some great light.
That's the pure sun
Yeah,
there.
that's the best kind.
Yes. She said
Okay,
she's
Dr.
trying to
Taylor
get
said you can't
on.
get on.
Okay, there she is. I'm accepting her. Hi, Dr. Taylor.
Hello, there we go.
I love the scenery in both of you guys' was it backyard and office?
I was like, let me do it outside and get some fresh air while we talk.
Okay. Um, so I really wanted to get into a discussion, maybe do a Q&A with some of the audience about Endometriosis Awareness Month. And so, as you guys know, I have endometriosis, and so I really wanted to bring in some professionals to answer your questions. I struggled in the beginning, really finding out about my diagnosis. Of course, you guys watched the show. Dr. Davis, she did diagnose me with endometriosis, and there's some misinformation put out there, and I just want to clear things up. Any questions that you have in endometriosis, because I do see a lot of people. They talk about how I knew I had endometriosis from the very start, and that's not how that worked out. You just automatically know that you have endometriosis, and just because you have pelvic pain or menstrual cramps doesn't mean that it's automatically endometriosis. So I'm going to start off with um, I want Dr. Davis to explain what endometriosis is and how the symptoms, how it's diagnosed, and then we're going to go from there. I think Dr. Davis froze. Wait a minute. Can you hear me, Dr. Taylor?
From my end, I'm
She
frozen.
said she got kicked out. Hold on. Let me see if I can add her back. There you are.
Okay, there we go.
Did you get a chance to hear what I said?
I heard what you said. Okay, let's see if we can get Dr. Taylor back. IG is playing with us.
Dr. Taylor's on.
Okay, I just see a circle, but if you see her, then great.
I don't see her.
You don't see her still?
Uh-uh.
I see you. I don't see Dr. Taylor.
Okay, I
Both
see
of
the
us?
both of you. Yep, I see the
Oh,
both of you. Can you guys see Dr. Taylor and Dr. Davis together?
okay. They said we see everyone.
There we go.
Okay. Okay.
Okay.
All right.
Okay.
We're good. Okay.
Okay, yeah. So I want to start off. One. Let's introduce you guys. Dr. Taylor, can you introduce yourself?
So I'm Dr. Yogita Taylor. I am a physical medicine and rehab physician that specializes in pelvic pain. So I see lots of endometriosis, but I also see other types of pelvic pain as well.
Okay.
Okay. And I'm Dr. Ashley Davis. I'm a minimally invasive GYN surgeon, and I specialize in endometriosis, excision, and fibroid surgery.
Okay. I really wanted to get into endometriosis, defining endometriosis and how it's diagnosed, and what it is and the symptoms. And so I wanted you to get into that, Dr. Davis.
Okay, well, endometriosis is an extremely common condition. It affects up to 10% of women. And it's a disorder where tissue that's similar to the lining of the uterus is found outside the uterus. And that tissue responds to your hormones. And every time you have your period, that tissue becomes inflamed. And the inflammation can lead to scar tissue and pain. Its main symptoms can be pain. So pain with your periods. It can cause pain with sex. It can cause just chronic pelvic pain where you have pain every day. And it takes an average of 10 years to get diagnosed, because since its main symptom is pain, we have to believe the patients that they're in pain. The way that it's diagnosed now is surgery. So looking inside the abdomen with a camera, with laparoscopy, we make a small incision, put in a camera and look, and you can see the endometriosis. And the endometriosis doesn't often show up on imaging. So lots of times people are told, hey, nothing's wrong because they can't see anything on ultrasound, but really there's just endometriosis there that they can't see on ultrasound.
And I have a question. Would you say that, one, I wanted to ask how the different types of surgeries, because I've heard the myomectomy and also I had the laparoscopy.
Mm-hmm.
And so I would like to know the difference between the two.
So a myomectomy is a surgery to remove fibroids, right? And that can be done laparoscopically through small incisions if your surgeon has the training. But traditionally it's done through like a C-section cut, where they open it up and then we go in and cut out the fibroids, repair the uterus, and leave the uterus. So you had a laparoscopic myomectomy. You had a myomectomy done through small incisions.
Oh, okay. And also one of the things that I wanted to talk about is really how, well, at least I can only speak for myself. When I found out that I had endometriosis, I don't know if it's like some symptoms that I can actually like look for or what, but before I was going to doctors and I was complaining about the pain, and I wasn't being heard. And so I know in my YouTube video we were talking about like documenting documenting some of your symptoms and your pain and all that. And so how would you say to the audience, like, how do you advocate for yourself, especially whenever you're getting turned around by other doctors and they're not really hearing you? And like, how can I tell between regular period pain and just, because to me it was normal for me to have bad cramping and throwing up on, I was on the floor, like it was terrible. And so for me to deal with that, it took me at least about 20 years to get diagnosed, because I started my cycle when I was like 11, and so went into my 30s that I found out, like, okay, I have endometriosis.
So I can answer that. So basically, it's tough, right? When you're trusting in your physician to take care of you and you're not being heard. I think that you should document your symptoms. I say write down how you feel every single day. And then once you write that down, especially for a couple months, you'll be able to see what symptoms actually coincide with your menstrual cycle. So that way you can really bring it to the doctor and say, hey, I have nausea, I have severe pain, I have this, going on exactly when my period, and you're able to put it together even yourself. And fortunately, we live in a country where there are a lot of specialists and there are a lot of doctors. So if you're not getting the answers you need from your doctor, seek a second opinion, even if that's virtually. If there's not someone in your city, seeking a second opinion can really help you and give you insight on like where to go. But you should definitely always continue to push for answers.
And it's hard because something you said was you thought your symptoms were normal, right?
Mm-hmm.
And maybe your mom dealt with them, or you've always dealt with them and you thought, hey, this is just how my periods are. But for symptoms to be taking you away from like your day-to-day routine, whether it's going to school, going to work, even like bowel bladder stuff, those are kind of like signs to say, hey, something is not right. And even though you felt like those symptoms were normalized, they're not normal for women to go through with each and every cycle. And, sometimes that pain goes beyond that period. And I always say, like, hey, you're spending half of your month feeling, you hurt the week before, you hurt the week after. That's half of your month, and half of your life where you're not functioning the way you want to. So a lot of that time when that pain is taking over the things that you want to do, definitely something to reach out to your physician to talk about. And again, getting that second opinion if you feel that you're not getting hurt is going to be
Okay. I have someone drop a question in the chat. At what age does endometriosis begin to develop?
So we think that pretty much you were born with endometriosis, right? It's not something that develops. And so it can develop, you start having symptoms when you start your first period. So it's very young. This is not,
Oh, wow.
yeah. So I imagine that anybody who has endometriosis, when you start your period, whether that's 9, whether that's 13, whether it's 16, that's when you start having pain and symptoms.
Wow, I actually did not know that you were born with endometriosis. I never knew that. I know my niece. One of the things that I'm just now finding out. Like my niece, she was born back in August, and so when she was born, like she actually, had like my sister was changing her. She actually had blood down there, and so I that was one thing that I was like, oh, I had no idea that baby girls, they're born when they bleed, and I'm like, I thought that was the strangest thing. So when you guys say that, you're born with it, I think that's
Yeah, that
interesting.
doesn't, you're not just supposed to bleed that early. You start bleeding at menstruation. I guess it's those cells are there, those abnormal cells are there, and they may start to grow or become symptomatic once once you go through puberty and once your hormones change. Not that you should start having symptoms as a baby
Yeah,
necessarily.
and I
Oh,
think, yeah, that bleeding you may have seen. Again, I'm not the GYN, but I was told when my daughter was born, you may see a little bit of bleeding because of the hormone surge from
Mm-hmm.
birth, but that wouldn't correlate with a period.
oh my goodness. Um, and Dr. Davis, Dr. Taylor, do you guys specialize in PCOS? Do you know anything about PCOS? Because I had a question in the chat to ask: is PCOS related to diabetes? You know.
I can answer that. Yes, PCOS puts you at higher risk of developing diabetes. If one of insulin resistance or your body not responding well to insulin or having issues regulating your blood sugar is one of the symptoms of PCOS.
Okay. Okay. And I'm going through the chat to make sure I'm answering people's questions.
Yeah, yeah.
Yeah, there's a question that asks if endometriosis mimics PCOS, since we're talking about PCOS. They're two separate conditions, but sometimes there's overlap in symptoms and sometimes they can come together too. So pelvic pain can be a symptom of both. Painful periods. PCOS tends to have more irregular periods. There's classic findings of small cysts if there's an ultrasound done, but then there's other symptoms of PCOS that you don't necessarily see with endometriosis. Weight gain, hair growth, abnormal hair growth, and that insulin resistance not typically seen with endometriosis. And then endometriosis tends to have much more significantly painful periods, sometimes more bowel and bladder symptoms as well. So some overlap, but two different conditions, and sometimes they happen separately or sometimes together. Both very inflammatory conditions.
Okay. I have someone that has a question. She says, my daughter kept telling her doctor something wasn't right with her body. They finally diagnosed her with low estrogen. She's on patches and other meds. Also, she may not be able to have kids. Oh my gosh. Okay,
That,
I think she was
mm-hmm.
sharing.
I'm
Wow. So you can be diagnosed with low estrogen. What does that do, the low estrogen?
Well, I don't have the whole history, but it looks like maybe she has premature menopause. If you have a premature ovarian failure, where your ovaries are what are supposed to, produce estrogen, and they can fail earlier in life than they're supposed to. That's a condition that can happen.
I have another question. It says, what are the long-term effects of endometriosis on fertility and the overall health?
I would let Dr. Taylor answer the one on just the overall health, but as far as fertility, endometriosis can affect fertility. We don't know exactly why. We think it has something to do with the inflammation, but about 50% of women with endometriosis may have trouble with infertility. The other way it can affect fertility is just structural, right? So that those spots of endometriotic-like tissue can become inflamed and lead to, the inflammation can lead to scar tissue, and it can have things stick together. So that's why one of the reasons that we really advocate going to the doctor early, for us to diagnose endometriosis early so it can be removed before it progresses so bad where everything is stuck together.
Oh, wow.
Right. And
Yeah,
then Dr. Taylor, I
oh,
wanted
go
her to
ahead.
talk about like some of the, it's a whole body disease, some of the systemic effects that can happen.
Right. So again, endometriosis is tissue outside of the uterus, so most commonly in the pelvic area. So most patients with endometriosis have more pelvic symptoms. So again, that lower abdominal pain, sometimes pain with bowel movements, urinary urgency, meaning you feel like I gotta go right now, going to the bathroom more often than normal,
Right. I have that.
pain with intercourse. Sometimes it can lead to something called vulvodynia, where the you feel vulvovaginal pain all the time despite not doing anything. Sometimes rectal pain, pain with sitting, pain with exercise. It can just again affect your day-to-day activity, and again, excision is the gold standard for treating endometriosis. However, even sometimes if pain and inflammation has been going on for a really long time, those nerves and muscles are inflamed that are in that pelvic area, which can lead to still ongoing symptoms even after surgery. And so that's where some of our treatment, where we're targeting those nerves, muscles, getting the patients moving, getting them into physical therapy, nutrition management, all of that's going to be really important to maximize long-term symptoms. And kind of again, the goal is to keep you functional. And many endometriosis patients go on to do wonderful things, be athletes, do all the things, but it's just a matter of kind of managing your symptoms and controlling what you can control.
Yeah, I feel like I'm one of those people that, I have a testimony with Dr. Taylor because I had a lot of pain during my cycles. And even after my surgery, I still had pain with my cycles. So I went to Dr. Taylor, and I mean, it was amazing the things that she did. Like, I was really afraid at first with some of the shots and all that, those things that I got, but the injections. And um, I will say, like, I've recently had, TMI, but this is a discussion, right? About endometriosis, but um, I was at work, I had my cycle this last week, and, the fact that I was able to, just pop an ibuprofen, and it just won for the day. I mean, that's record breaking for me because I was taking like ibuprofen with Tylenol, like 2 Tylenols. It was just like I was doing a lot. I went from the naproxen. I've taken a lot of different medications just to like maintain my
Yeah.
pain over the years, and it still was never enough. Like, I've always been able to, well, like when I was younger, I would always go home from school, and then like to grow into my adulthood, I was going home from work, and so I was getting very desperate, going to the doctor, and I was crying tears, and they were like, there's times the doctors told me like, that's just normal. I mean, get on birth control. And so even when I got on birth control, I still was having the same problems, or it was causing more problems for me.
Yeah.
And so it was very, very frustrating and difficult. And so when I finally, got to visit Dr. Taylor, I was like, okay, there are other answers. It doesn't just have to be only birth control. That's not the dead end.
Yeah.
And so I think that, you know, people are so quick to throw that at you. But, for me, I never wanted to be on birth control because of all the issues that I've had. And also, being a mother is a number one thing for me. That was my goal. I felt like that was my whole purpose in life. And so I don't know, like that's just me mentally. I kind of felt like I had a stigma for taking birth control. and I just didn't want to mess my chances up of being a mother because of all the side effects I've heard from taking birth control. And so
Well, I just interject there that birth control does not affect your fertility in the
okay.
future. And birth control has a role in treating endometriosis when it works, right? It doesn't treat the endometriosis. All it does is it helps us manipulate your cycle or maybe skip your cycle, and it can help with the pain. The problem is where we don't listen to women when they say, hey, this is not working, right? Because it's not a specific medication for endometriosis and it doesn't work for everyone. And sometimes people do have side effects. And so we have to listen to our patients. And if it's not working for them or they're having a side effect they can't tolerate, then we need to find other options.
Right. Yeah.
So our role was we targeted some of those nerves of your pelvic floor, the pudendal nerve, and you had the ilioinguinal nerve, and then we targeted the muscles of your pelvic floor. So as those areas relaxed and calmed down, you can see how better you feel now.
I have a question. And I see someone else has a question. They said that I have a frozen pelvis. That is when I found out I had endometriosis. I've never heard of a frozen pelvis. Have you heard of that term?
So frozen pelvis is just a description of when I talked about endometriosis causing scar tissue.
Okay.
So all of your organs in your pelvis are supposed to be separate. The uterus, the bowel, the ovaries, they're all supposed to be, they're all attached and they're all there, but they're touching, but they're able to move around. Endometriosis can cause such scar tissue where everything is frozen together and the normal spaces of the pelvis aren't there. And that's one of the symptoms of stage 4 endometriosis, where we call it a frozen pelvis. It's more of a surgical term.
Yes. Like my, I remember that you were saying that I'm like, mine was like retroflexed.
Mm-hmm.
And so it could have been caused by some of the scarring and all that, and from endometriosis.
You definitely had a lot of scar tissue.
Yeah. I'm trying to see if I have other questions. Someone said, I've read that endometriosis can be found in the brain and lungs. Could severe migraines be a result of endometriosis being in the brain?
Not as commonly. So yes, we've seen case reports of it in every single part of the body. That's not as common. She's correct that migraines, a lot of people with endometriosis also suffer from migraines. That's a disease that's comorbid. We think it has something to do with inflammation, the hormone levels, but it's very common for women to have both a migraine disorder and endometriosis.
So that's a lot more common than having endometriosis in the brain. And again, like Dr. Davis said, like there's a hormonal component, there's a nerve component, and then there's all these muscles around the skull. And fun fact, the pelvis and the jaw were actually like together when we were embryos, and they eventually split. So sometimes TMJ, a lot of these muscular issues can happen with pelvic floor dysfunction as well. Like all these nerves and muscles get tight as well. So it's common to see it together, but not necessarily indicative of brain endometriosis.
Wow. This is a lot of information. Oh my gosh.
Tell me, they're like, we talk about injections and things like that, and they're like, yeah, I understand, because I get, injections to, my muscles that treat, muscles for the migraines. So
Someone asked a question. It says, I was diagnosed with endometriosis over 40 years ago. Why hadn't there been any advancement in diagnosing women? Now, that's a great question.
That's a great question. There's not enough research done, and we need to do more, and we're working on that.
Yeah.
Yeah, it's very sad.
Yeah.
I think it's it's kind of a man's world that we're living in. Because I never thought they would overturn Roe versus Wade. So I just I don't want to get on my soapbox. So let me see that.
That could be a separate Instagram live itself.
Yes.
Let me see. It looks like I have another one that came in. Someone said, if I didn't have endometriosis before my pregnancy, could I develop after a C-section?
Yes, sometimes. Yes, that's possible.
Oh, wow.
I've heard, so again, the endo may have already been there, but not necessarily bothering. And then, like, the surgery itself could seed the endometriosis.
It's a combination of both. Sometimes people have endometriosis and they're not symptomatic till later in their life when the disease progresses, and that can happen to be later in their life after they've had kids. And when we do a C-section, we have to cut through the skin, through the fascia, through the uterus, and into the endometrium to get the baby. And sometimes little pieces of the endometrium can get in the C-section scar. Again, not something that happens commonly, but definitely can happen. And so that may be what she's talking about. But a lot of times, most of the time, it's what Dr. Taylor said, the patient already had endometriosis, but maybe the symptoms weren't as severe, and then now they're getting severe.
Okay. I'm going to have another question. What are some of the more uncommon symptoms of endo you've heard over the years? You know, anything abnormal that you never seen before that was endometriosis related?
So I think I've seen a lot, some things that you may not think of. So endometriosis can be sometimes in the belly button, and you can have a nodule, like a mass in the belly button that bleeds when you have your period. I've had several patients with that actually, and their doctors told them, well, it's normal. It's not normal to bleed from your belly button
Oh my God.
ever.
Yeah, I never heard of that.
So yes, it can cause some crazy symptoms. Endometriosis can also, if it's very severe in the lungs, it can cause the lungs to collapse.
Wow.
Yeah, and these are very, severe cases.
Sometimes I've seen a few patients with pain down their legs, and again, a common symptom anybody could have from like back pain, pinched nerve in the back, but with all that workup, sometimes that can come back completely normal, and there could be endometriosis like on the sciatic nerve, and that sends like leg and back pain, or leg and like butt pain.
This is just a random question. I know at one point, right before I found out I had endometriosis and I was having issues, I remember I was on my cycle and I had a lot of pain. I remember I was in so much pain. I was on the floor and in tears. And but not only that, I ended up having kidney stones as well. Like it was just like it was the weirdest thing. And I thought that at first it was like my cycle, like I was just having a lot of issues. And then because that was the norm. But then when I went to the doctor, I went 3 times in a week, and I found that I had kidney stones. So I didn't know if that was if the two had anything to do with the other. I'm not sure.
They're not necessarily related, but they're both very painful conditions. And you just happen to have both flaring at the same time. I'm sorry, that must have been horrible.
Oh, that was the most worst thing in my life. It was the most worst thing in my life. I wouldn't wish that on my worst enemy.
Yeah, I can imagine. I'm sorry.
Yes, it says. You see, someone says, "Why can't I still have kids after? Why can't I still have kids after having it over 10 years? Why can't you still have kids?" I think that's what she's saying.
Well, there can be many, many reasons for infertility. Endometriosis is one thing that can cause infertility. When you think, sometimes it can be something wrong with the uterus. There's a lot of things that have to go right to get pregnant. The uterus needs to be normal. The ovaries need to be normal and ovulating. The tubes need to be open for the eggs to get from the ovaries to the uterus. And then the sperm needs to be normal. A third of the time, it's something going on with the sperm. So if you're not able to get pregnant after trying for a year, having unprotected, intimacy with your partner for a year, then it's time to get evaluated, because you have to check all of those things to figure out exactly what's going on. So seeing your OBGYN or seeing a fertility doctor, they'll help you get worked out.
Okay. Would you two recommend any lifestyle changes that you need to make when you have endometriosis, or avoid? Well, not really avoid it, just manage it.
Yeah, Dr. Taylor, I'm going to let her get this one.
Big ones are diet. I would say, again, endometriosis is a very inflammatory disease process. And so we want to minimize that inflammation. So endometriosis creates inflammation, but also thrives in inflammation. So if we can minimize inflammation in general, diet especially, so minimizing as much processed foods, and maximizing like the berries, the green leafy vegetables, the omega-3s, that is ideal. And then there's aspects of like stress management. So like I said, there's muscles that are holding like your organs, your bowel, bladder, uterus, and all of that. And when we get stressed, those muscles, just like any other muscles, they squeeze. And so again, a lot of my patients, they have this tight pelvic floor that's contributing to their pain. And so that in itself creates a lot of inflammation. So working on stress management, yoga is a great exercise. Again, movement is going to be helpful for stress management. Walking, yoga, swimming, like, gentle stuff is excellent lifestyle wise. Again, avoiding smoking, alcohol, minimizing alcohol,
Yeah.
getting enough sleep. Those are the big lifestyle things that I would promote. Again, we can't be 100% perfect, but those are the big things I would say.
I saw someone ask earlier, is there a way to cure endometriosis naturally? And unfortunately, there's not any way that has been proven. And there's not a medication either that we know of that can take endometriosis away. But like Dr. Taylor said, those lifestyle changes that decrease inflammation definitely can have an impact on your symptoms.
Mm-hmm.
As part of the larger management plan. So it's not about lifestyle versus medicine. It's we really have to all work together, just like surgery, trigger point injections, pelvic floor therapy. It really requires multidisciplinary care. We all have to be together.
Absolutely. Patients that do best are the ones that get it, that we got to do it all together.
I would say also that it's important to have an accountability partner, whether it's your family member or husband or, you know, even a fellow person, warrior. And so I actually met a friend through IG, and she too has endometriosis. And so we really got a chance to bond over that. And so she's really my accountability partner, like even when it comes to sugar, she's like, do you want to do this? You know what's going to happen, right?
It's
And
tough.
so
It's tough.
And so, a lot of support, like my support system, more so, it has come from like my family, friends that I've met. Also, I have joined some endometriosis support groups on Facebook. I'm an advocate of a support group, and it's really cool to hear other people share their stories because you have like that mass bloating that I was really getting worried about, and so like when you go to these support groups, you know that you're not alone.
Mm-hmm.
You know,
That's
and
very
so
important. And the
yeah.
social aspect, that's an important part of taking care of pain and chronic disease as well. Like you need support. You need to be around your loved ones. You need to feel like you're not alone. And I feel
Yeah.
like endometriosis patients can feel so isolated because they're told for so long that, hey, nothing's wrong with you. And it really takes a toll on your mental health.
Absolutely. Absolutely.
Yes, I have another question. Someone said, outside of endometriosis, what else can I go? Where else can I go um, to a pelvic specialist for? So I guess she's just saying like, what else outside of endometriosis, Dr. Taylor,
Yes.
you offer, or what service do you offer outside of it?
Yes. So I see patients with pain from kind of the belly button to the thigh. So whether it's hip pain, groin pain, tailbone pain, rectal pain, it can come from lots of different reasons, whether it's endometriosis, fibroids. Sometimes it's postpartum patients that don't have anything else going on. I've seen men too. Sometimes men have overactive pelvic floors because they have, they're athletes or they've had hip injury, back injury. That's the big stuff that I see as a pelvic pain physician. I know a lot of pelvic PTs will also see, incontinence, whether it's urinary incontinence, bowel incontinence, prolapse. Going back to what I see as well as what pelvic PT sees, pain with intercourse, whether um, something that's been going on for a long time or it just developed, because sometimes menopause, changes in hormones, that perimenopause state can make changes that lead to us getting inflamed, and there's pain with intercourse that wasn't there before. So those are a lot of things that I see. So
Okay.
it doesn't have to be endometriosis related.
Okay.
Yeah.
It's another question. Someone asks, do you have any recommendations on what to avoid to eat?
A lot of things that are packaged that have a long ingredient list. That's a big, again, like a lot of patients are going to be sensitive to high sugar, sometimes dairy and gluten.
Yeah.
So again, not everyone has the same sensitivities, but again, when things are more processed, there's more things that are added to preserve it or make it taste better and things like that. And that just adds more variables, right? So if you stick to things that are whole, whether fruits, vegetables, meats that aren't like overly processed, it's going to be less triggering in general. And so other things to avoid. But I would say gluten, dairy, sugar are the big ones. But then sometimes it may require you to see like a nutritionist, dietitian, or someone to like work one-on-one with you on your specific symptoms.
And that's
not
where it goes important into tracking your symptoms, right? So you can see what foods affect you.
Yeah.
That's true.
Yeah, it's not the same for everyone.
Yeah, and I've always been told that, like, whenever you go grocery shopping, especially, I mean, even in this case, like, it's best to go grocery shopping and shop at the perimeter
Mm-hmm.
of the grocery store.
Yeah.
And so I try to stay from in between those aisles.
Yeah.
Someone else has a question. What is endometriosis
Mm-hmm.
is related to in endometriosis?
So adenomyosis is related to endometriosis. So we talked about endometriosis being the abnormal tissue that's outside of the uterus. Adenomyosis, so the uterus is supposed to be separate layers. It's supposed to be the lining of the uterus and then the muscle layer of the uterus. So in adenomyosis, the lining of the uterus has kind of infiltrated into the muscle layer, and you have these little areas of abnormal glandular tissue or endometriotic-like tissue in the muscle layer of the uterus. And that it means the uterus in and of itself is normal. And that can cause very similar symptoms to endometriosis as far as pain, pain with intimacy, chronic pelvic pain, but it can also cause really heavy bleeding.
Oh, Lord.
Right. And so it's sometimes hard to diagnose adenomyosis, and a lot of doctors don't look for it, but we can sometimes see it with an MRI.
Okay. I'm reading the trying to keep up because they're going fast now. In what ways does pelvic specialist? So someone just, some people are just popping in, and we may be repeating some of the questions. So so someone asks, in what ways does a pelvic specialist impact endometriosis?
Yes. So I treat endometriosis patients who have chronic pelvic pain. So that will often be a majority of endometriosis patients, but again, not all endometriosis patients have pain. So what my role is as a physical medicine rehab doctor is I treat the nerves and the muscles of the pelvic floor, but also look at the back and the hips, and treatment big thing we do are injections targeting those nerves and muscles of the pelvic floor. Sometimes it includes medication management. Sometimes again, some of those lifestyle things we talk about. And again, sometimes sometimes patients come to me first without having any idea of why this is happening, and I can help connect you to the right people, whether it's someone like Dr. Davis, who's an excision surgeon, or going to pelvic PT, or seeing a urologist, or sometimes an orthopedic surgeon, just kind of helping navigate that pain aspect, treating it, and then figuring out if there's any other next steps that we need to think about.
Okay. I have someone, the Miss Murray, she says, I got diagnosed later in life. I was able to have babies, but now it has gotten worse, and I'm going to move forward with a hysterectomy. And so my question is, is there ever a case that you recommend a hysterectomy when it's just
So
too much
yes,
for the
sometimes
patient?
that is what's needed, right? So hysterectomy can be very helpful when there's actually something wrong with the uterus, like adenomyosis or like fibroids. Fibroids are benign or non-cancerous tumors that can grow in the uterus and cause pain, heavy bleeding. A lot of women have both of these things going on. They have fibroids and they have endometriosis, like you did, right? The important thing to remember when treating endometriosis is that a hysterectomy is not a cure for endometriosis. So taking out the uterus is not, and leaving the rest of the endometriosis in the pelvis is not going to be helpful. The patients can still have pain. So it's super important that you go to a surgeon that is going to excise or cut out the endometriosis as well as removing the uterus. And so I would just say that's, if you do consider hysterectomy as an option, just make sure you're going to a surgeon that is trained to treat endometriosis and cut out all the endometriosis so you can really be cured.
Right, that's true. I know growing up, I was like, as soon as I get older, I'm getting this out of here. And then once I have my kids, because I just value my quality of life. I really do. But like I said, being a mother is the number one thing for me. But I'm gonna get my babies, and then hopefully I'll be a candidate.
So we'll see, right? But hysterectomy is definitely not your only option. It's not the first option. And if a doctor, that's the first thing they say to you, especially if you're young and you've expressed you want children, and they tell you need a hysterectomy, that's not it. You need a second opinion.
Right. Someone says, gosh, I don't want to give up on white rice or white bread. Maybe there's a discussion going on in there.
I love rice too, y'all. I love it.
Yeah, I love white rice and bread as well.
And,
Um,
and like I said, we're not here to be perfect. So if 80% of your diet is the good stuff, the other 20% you can have your rice and your bread and chocolate, and it's
in
have
moderation.
Everything in moderation. Yes.
yes.
Make sure you exercise.
Oh, I do have one question. Are fibroids painful? Because I was told whenever I went to the doctor and they told me that I had fibroids, and they're like, well, it shouldn't cause pain, and I could very well have had the endometriosis pain back then,
Yes.
but I was told that it doesn't cause pain.
So fibroids, yes, they can cause pain, right?
Okay.
And a lot of women, people have endometriosis and fibroids, and it can get complicated, right? Because we can't see endometriosis on ultrasound most of the time. People get an ultrasound, they see there's a fibroid, and they may be told, well, you have pain because of your fibroids, you need a hysterectomy, and there's nothing else to be done, when really they actually have endometriosis. But fibroids can cause a lot of different symptoms. It all depends on their location and size. So if these fibroids are found in the lining of the uterus, they can cause heavy bleeding. And when you're bleeding really heavy and your uterus is cramping, yes, it's painful. Fibroids can be on the outside of the uterus and be pressing on other organs, and yes, cause pain with intimacy. So that's completely not true. Yes.
I don't know why they told me that
I
that
don't know. Like you're there in your body and they can tell, like, how are you going to tell me what hurts? When
that's how I felt. Like, I know what I'm experiencing. So, I'm like, well, there's no way that this can be normal that I'm going through.
it's not normal.
There's no way. I got plenty of stories. It says, when is surgery recommended for fibroids and for endo?
It depends on the symptoms. It depends on the patient. So surgery is always indicated for endometriosis, right? Because that is the way we diagnose it and treat it. So you don't have to have failed medication, or you don't have to be in severe pain. If you've discussed it with your doctor and you've decided you want to have surgery for endometriosis, then that's when it can be done. As far as fibroids, it depends on their size and location and your symptoms, right? Sometimes people are told, well, you shouldn't remove the fibroids until right before you're trying to get pregnant. You are a candidate for surgery when these conditions are affecting your quality of life. Then they need an intervention, right? And that is not always a big surgery. There's surgeries that can be done through, without even making any incisions. There's procedures where we can shrink the fibroids, where there's medications we can use. So you should seek treatment if you are uncomfortable and this is affecting your life.
Yes.
I agree. I'm trying to think because I had a question, and then I started reading other people's questions. I think it was pertaining to fibroids, but it'll come back to me. Okay, let's see. Is this an age thing or a later on in life thing? Someone just
It's both, right? So it's more common as you get older because the longer we live, the longer that we have, these problems can get worse with age, but they can present very young as well.
okay.
Yeah. So
Someone
yeah, yeah. I mean, most of our patients are on the younger side, meaning 20s, 30s, 40s. But we also see women who have been dealing with a lot for years and never shared it. Or, again, like I said, menopause, perimenopause can create new symptoms that we never had before, too.
Okay, my question came back in my head now. I don't know. It might be the endo. Blame it on the endo. Brain fog, right? But my question is, I'm 33 years old, and of course, you guys, I have endometriosis, and so is it best to people my age to like freeze their eggs because my AMH, my egg count is low. Um, I think that it was higher before the surgery. I think that it was at like a 1 point something, and now I'm down to a 1. I'm down to a 0.6. my AMH. And so I think people worry like, should you freeze your eggs just in case? You know, with endometriosis, can you lose more eggs? I think those are like my worries.
So
Yeah.
endometriosis can affect your egg count, and we don't know the exact reason. We think it has to do with inflammation. And for reference, what she's talking about is the AMH level, which just looks at really how well you may respond to treatment, the fertility treatment, how well you may respond, like what your ovarian reserve is. It doesn't correlate with your ability to get pregnant spontaneously.
Oh.
And any time you do surgery on the ovaries, it can affect your AMH. And it was 0.8 before surgery, 0.6. So, and yes, the long answer to this question is yes. If you have the means to freeze your eggs, especially if you're young and you know you have endometriosis, it doesn't mean that, having endometriosis doesn't mean you're going to have infertility. But if you're able to, not everyone is able to because it is expensive, it's always a good idea to have that insurance policy.
Oh yeah.
Because
That
we
is
don't want you just having a baby with the first man that comes along either.
correct.
Right. We want you to have options.
Yeah, and and I was told even if you do have a low egg count, it's about quality and not quantity.
Yeah,
Exactly. And age. Your age is one of the biggest factors when it comes to fertility, regardless of your numbers. And you're young.
I'm young enough. Let's see. So many natural herbal treatments that can easily help you conceive. I know a lot of people are like kind of holistic, so I have a lot of people recommending like try different teas and all that. And so I don't know, what do you recommend for endometriosis and also, fertility?
I'm one of those. If you're taking a tea and you feel like it helps your pain, great, right? But you also have to understand that like there are no randomized controlled studies where we look at giving people a tea, not giving people a tea, and seeing who gets pregnant. So there's no evidence to support that it's going to work, right? And so that's why we can't recommend it as a medical treatment, where we have evidence about some of the fertility treatments. And I'm very into wellness and I believe in all the holistic things too. And I would never tell you not to do anything that you feel like doesn't help you, because there sometimes can be benefits to decreasing inflammation by some of those supplements. But don't take too much time, right? And not pursue medical treatment because you're just focused on the holistic. Real wellness is where we put medical treatment and the holistic or non-medical treatments together, right? It shouldn't be either or.
agree. I agree 100%. Like, again, there's a role for holistic treatment, there's a role for medical treatment, and again, sometimes doing both together is great. And I think it's really important to be open and honest about what holistic treatment you're doing, whether it's a tea or whether
Yeah.
it's a supplement, because sometimes things can interact or can influence things, and it may also help put pieces of the puzzle together if something odd is going on as well. So not to say don't do it or do it. It's just a matter of what works for you, but also making sure you're doing it safely.
Yeah.
Okay. I have someone else. What is the recommended procedure for belly endometriosis in general? Also, at what age do you recommend freezing eggs? Okay.
For the belly, if you have the belly endometriosis, like I talked about, where we're cutting where you're bleeding from your belly button, you have to cut it out, right? That's the treatment for endometriosis, to surgically remove it. And then as far as what age to freeze your eggs, I mean, ideally the younger the better, right? So the ideal age is probably 18, right? Is that realistic for most people? No. So just, when you can, you know, um, just see a fertility doctor. They'll look at your numbers. They'll tell you what your chances are, and definitely pursue it if it's something you're interested in.
So, say if endometriosis is found, I know that it's throughout the body, and if it's somewhere abnormal outside the pelvic floor or the pelvic area, do you then refer them to another specialist to remove that, or you have someone in the room with you and
Yeah,
doing
no,
the procedure?
it's super important that just so like Dr. Taylor and our multidisciplinary team in the clinic, in the operating room, we need to have a multidisciplinary team. So wherever we find endometriosis, we have a team that can take it out, right? So if it's found on the bowel, we have a colorectal surgeon available to be able to cut it out from the bowel. Or if there's something complicated with the urologic symptom like the ureter or the bladder, we have a urologist available. So having surgery in like a big hospital with a doctor who has relationships with other doctors is important.
Wow. That's so interesting that it can be found throughout the body, because I felt like when I had when I had that flare up, and I came to your office, around that time I was just very exhausted and I was always tired, and I got better right after the surgery. But that was the most strangest thing. I just noticed like I was sweating more. I was miserable just going out with my husband, and I was like out of breath. And
That
this is just
abnormal tissue was causing inflammation, and so cutting it out and removing it is a big part of the treatment. And then you needed Dr. Taylor to treat the nerves and muscles that were left behind that had been kind of traumatized from that inflammation and get them functioning correctly.
Yeah. Your body was in overdrive before surgery and also after surgery.
Yeah. How long does it take to recover from endometriosis surgery, from getting laparoscopic surgery or the myomectomy?
Yeah, it depends on how extensive it is. As a general rule, when you have laparoscopic surgery, you're back to sitting at a desk, working from home after 2 weeks, going into the office 3 weeks, and there's no intimacy, no exercise, no lifting heavier than 10 pounds, and no pools for 6 weeks.
Okay. Someone asks, let's see, does endometriosis and adenomyosis cause cysts?
Endometriosis can cause cysts to form, yes.
Okay. Does low estrogen and low egg count weight inconsistent? But let me see. I don't understand what that is. Does low estrogen and low egg count weight inconsistent? I'm not really sure what they mean by that. Okay, Dr. Taylor got me through until my surgery last year. Dr. Davis, you were almost going to do my surgery, but Dr. Hawkins did it instead. Truly a full circle moment seeing y'all together. And I'm for me too.
Yay! And I'm glad you had your surgery. I know Dr. Hawkins is awesome. Yes.
I was like, for me too. um, but do you guys have any last words before? I don't think we have any more questions, but I really appreciate the both of you. You guys both also have helped me from start and continue on, and hopefully to finish.
Yes,
Yeah.
exactly. Give that baby.
Yeah.
Yes, to
Yeah.
finish. Yes.
Yes,
Do you
no,
have any?
thanks for having us on here. I'm glad. I'm just, like I said, Hoda, I'm really proud of you for your commitment to sharing your story and helping other women. And you know where to find Dr. Taylor and I. We're at the Pelvic Rehabilitation Medicine and on East Coast Ferry in Buckhead. So if you guys are interested in seeing us, and please, if you guys have any more questions in the chat, let us know.
Absolutely. This is a pleasure. Again, like being able to treat you and having this full circle moment's amazing. And the fact that we're able to share this with so many of your followers, T, getting the word out, kind of, again, endometriosis, again, the research isn't fully there, but getting this word out, making women more knowledgeable, also men more knowledgeable about these types of symptoms, it just helps to improve that advocacy for these patients.
And the main goal is pain is not normal, guys. It's not normal. Don't
Yeah,
let
it's
anyone
not
tell you.
normal. Let's not make it normal. And so, it's very abnormal. And so, like, during my journey, finding out I have endometriosis and through the years, and then finally coming across you two, and you guys helping me, you guys really inspired me to come up with my own foundation. I came up with the name. I haven't really done with it yet, but eventually I do want to have like a whole board, and I want to, get together and educate the community and women out there about what you two do. And I came up with my name is called NOMO, and it's National Outreach for Menstrual Optimism, because I want to everyone to have a positive outlook on their cycles. Because whenever you talk about cycles, it's an uncomfortable conversation. Like I've never enjoyed talking about my cycle. I've always hated I hated to see it coming. You know what I'm saying? I always hated to see it coming. They talk about Aunt Flo. I hate Aunt Flo. I always felt like that. And so the fact that I can manage Aunt Flo,
Mm-hmm.
you know, I can manage her and control her. I think that's amazing. And so I really appreciate just coming across you two and having you guys in my life and the things that you guys have done for me and doing for other women out there. And I appreciate you. And I'm giving y'all flowers.
Oh, thank you.
Any other questions before we hop off? I think that we are good. Thank you, Dr. Davis, Dr. Taylor. You guys are wonderful.
Bye.
Bye. Bye, my Endo warriors. Bye.